Hey there everybody. Today I thought I would discuss a simple process, seemingly simple, but tremendously critical process of manufacturing a soft tissue cast on a closed tray impression coping transfer system. Whether it's the closed tray or the open tray, the process is similar, but I wanted to point out the closed tray because there is a little bit more room for error with most systems. So we have the single implant impression, mandibular impression. It's a Nobel replace implant. I believe it's a Nobel impression coping component. And this is a third-party analog. First step is be sure that the analog and the impression coping are properly connected and tight. That you don't need to use a driver, but finger tight. If you needed to use a hemostat to be certain, that's fine. Next, we'll analyze the impression to be sure that the indexing, so the grooves, various systems have different methods of indexing, but whatever aspect of the impression coping that will align the rotational position is incorporated into it, that the impression is clear and there aren't any variables there that maybe would warrant retaking of the impression. I can see in this one that everything is clear internally, so I can align the impression coping's indexes with the impression, and I'll feel for a tactical seat. I can see that that is there. One side note, some of the systems, the older Nobel, for instance, the three grooves were not symmetrical. So they looked symmetrical, a quick look, but careful inspection showed that one was offset. And it had to be placed into the impression at exactly the right orientation. If it was misaligned, it could feel correct, pretty close, but it wouldn't be. So note your system, understand your system thoroughly. Then, this is Iprogum. It does not need separator from PVS, but if it was a PVS material, you'd want to use some kind of a separator onto the material to prevent the bonding of the similar vinyl materials. It won't hurt if you put it on Iprogum. The separator could be just about anything. I use the separator that I use to separate wax from my dyes when I'm making a wax pattern. Vaseline, mineral oil, Alcoat, number of products work equally as well. And we'll just use a little bit of an air blast to dry that off. Next is something that I like to use is a little bit of Play-Doh, simple Play-Doh. This can go into the adjacent teeth and act as a controlling mechanism to control the flow of the material. If there was a tooth preparation there, it would help to keep the material away from the tooth preparation. It contains it and makes for a nice, neat cast. Our goal is to have an impression, a soft tissue component that can be removed from the cast, maintain its structural integrity, and be able to be replaced onto the cast numerous times without it tearing or distorting. So we want a thick enough piece of material. It needs to at least cover the interface between the analog's prosthetic surface and the prosthetic interface of the impression coping. That's a minimal. It can go longer. You don't want the material to go all the way up to the retention grooves on the impression coping itself, but that's a minimal. I would say 10 millimeters thick, 8 millimeters thick. You don't want it something very thin. And you don't want it to be excessively thick either. The Play-Doh material sort of allows me to control the flow of the silicone when I inject it. And it makes for a very nice, neat cast. It's difficult to cut the silicone later. There's other ways to do it. I personally like this one. So once we have this in place, I can get my silicone material. It doesn't matter, whichever one you like. And I will inject it into place, making sure that I fully capture the cast. And I'll try to leave it without strings. One of the guidelines that I use when selecting a soft tissue replication material, silicone material, the pink material, I like it to flow long enough that I can get rid of those little tails. Some materials will set rather quickly, and the tails will harden before the material can resettle itself. This product is Zermax Gingerfast material, and I'm very pleased with it. So now we'll just let this set fully, and I then can remove the Play-Doh. One of the things I like about the Play-Doh, first of all, it's very easily attained. You could buy it anywhere for next to nothing. But it's also very soft, very pliable, easy to work with. Doesn't contaminate the impression. It's water soluble, and I can just pull this off very easily. Should something be stuck in a very tiny area, a little bit of water with a disposable brush of some kind, a micro brush, just flushes it right away. Okay, I think the material is set. Yes. So you can see the Play-Doh just pulls right out, beautifully clean inside the impression. No gingival material has gotten into the tooth, into the teeth on the impression. This area, there were no teeth here. But again, you can see, so if there should be some left over, if it was in a spot that you couldn't really clear it off too well, it's water soluble. If you should forget it and let it sit there too long, it'll harden. Again, it's water soluble. So we'll just make sure that there is no residue. And now I can box this impression and pour it with a type 4 or type 5 resin reinforced stone, or something similar. I definitely do use a type 4 or type 5 stone because it's stronger, it's harder, it's more dimensionally stable. So that's what I like. So I will box this